Alright, this educational video is really to help people that have had lumbar spine surgery, so back surgery, get out of bed, and so we're going to be working on log rolling, sitting on the edge of the bed and then standing up with just a few simple techniques that I've found really useful over the years. So my patient Heather has recently had a spinal fusion. She's day one and we're going to get her out of bed. The first thing to say, Heather, is if you can bend one leg up at a time and then this leg. So basically I want both legs up. Alright, we're going to get out on this side just for convenience. I want your arm across, and what we're going to do is we're going to roll on the count of 3. And what I want you to do, Heather, is I want you to take a deep breath and roll on the breath out. Alright? I'd also like you to engage your pelvic floor before you breathe. Now I know I'm asking a lot, and we can break this down when the physios see you in hospital, but for the sake of this video, I'm going to assume Heather knows how to do this. So what you're going to do is contract your pelvic floor, take a breath in, breathe out and roll. And the idea of log rolling is obviously to keep the spine straight. I'd encourage you guys to roll fairly briskly. Don't labour the rolling. You actually want to use momentum when you roll. So once you're ready, the breath out also deparalyzes you and is a stimulus to move. Alright. So lying on the side is generally quite a comfortable position. In terms of sitting up from here, we're going to basically be doing the same thing. We're going to be encouraging a breath out. We're going to be encouraging the pelvic floor to be engaged before we move. So what I'd like you to do is use this hand to push up, dig that elbow in. I'm going to come into this position. Bring your legs over the bed a little bit more, and we're going to go on the count of 3. So I want you to take a deep breath in, breathe out, and lift up, and come on. And we are sitting. Once again, that breath out is a stimulus to move. I'd also encourage the patient to do it relatively quickly, just so that we can use momentum. Alright, do you want to scoot forward a little bit? I'm just going to lower the bed a fraction. So obviously when you're sitting you may be a little bit dizzy, so it's not a bad idea to sit for a while to let your blood pressure stabilize and just to observe to make sure that their colour is reasonable enough to stand. Now the tips for standing up are as follows. Get the legs nicely wide apart so we've got a nice stable base. Make sure the feet are underneath the knees. Alright, and then Heather, what you're going to do is you're going to have your hands on your knees and you're going to have a gentle rock. And on the second one, you're going to explode up and breathe out. And stand up. Alright, the rock doesn't have to be an accentuated rock, it's really just gathering momentum. We're pushing up off the thighs to purely prevent rotation as we come up. You equally can push off the bed to do that, but I actually find if you push off your thighs, it actually makes a lot more sense.